Good afternoon, everyone. This is Dr. Nguyen from Ironwood Cancer Research Center. Today, I'd like to talk to you about a new modality for treating breast cancer from a radiation standpoint. It is called accelerated partial breast irradiation. But first, let's talk a little bit about the background. There will be some eligibility criteria. Not every breast cancer patient will be a candidate for this type of treatment, but we'll go into more details about that as the talk progresses. And finally, we'll talk about the nuts and bolts, how it's treatment delivered, and so forth. Now, let's say you just got the diagnosis of breast cancer. Let's also assume that your breast cancer is fairly small. You speak with your breast surgeon, and he or she talk about the surgical options. Now, going back as early as 19th century, people have used mastectomy as a way of treating breast cancer. And that was the only option available back then. But the momentum started to turn back in the 1970s, 1980s or so. Doctors found that we could do lesser surgery, the so-called lumpectomy, taking out just the tumor alone, maybe a little rim of healthy breast tissue all the way around. And that was a lot less disfiguring, and the recovery time was a lot faster. But as it turns out, doing surgery alone, that is a lumpectomy, was not sufficient to treat breast cancer. So we have to do some other treatment on top of that. And that treatment is obviously radiation. Now, there are two ways of giving radiation treatment. One way, this is the more traditional method, is treating the entire breast. As you can see by my pointer, the entire breast is exposed to radiation treatment. So the whole breast tissue is treated. Process lasts anywhere from 4 to 6 weeks. Common side effects include fatigue, some skin reactions, some swelling of the breast. Now, what's the downside to that? Well, obviously, it takes a while, and people came up with this new modality. We treat just part of the breast with radiation alone. Obviously, it spares more breast tissue, and studies have shown that, cosmetic-wise, long-term results are a bit better. So the term accelerated partial breast radiation, let's talk about the acceleration part. It's faster, that is, they only take 5 days of treatment, and they can be potentially less side effects compared to the more traditional method. And depending on your insurance plan, is most likely less expensive. Now, as I said earlier in my talk, not every patient will be a candidate for this type of modality. So common eligibility criteria, your age has to be greater than 50 years old. Young age, we know in the past, is a risk factor for cancer coming back. And the lumpectomy surgery has to be a complete success. That is, there is no cancer remaining in the breast, and there is no involved lymph nodes in the axilla area. And finally, the tumor size has to be about 3 centimeters or less, which is roughly a little bit over an inch. So here at Ironwood, this is the treatment machine. As you can see, people will lie on the treatment table, and this is where the radiation comes from. On the next slide, this is a CAT scan representation of what treatment delivery is like. As you can see, the red outline will be the part where the radiation is going to, as opposed to going to the entire breast tissue. They'll just go to the part where the tumor used to be before the surgeon successfully remove it. So in summary, there are 2 methods of giving breast radiation after a successful breast conserving surgery that is less than mastectomy. We can treat the entire breast, or we can treat part of it. Skin reaction is a little bit better with the accelerated partial breast radiation. Cosmetic is also a little bit better. Time to complete is a lot faster, it only takes 5 days. Selection criteria is a bit more stringent with the faster method, as opposed to almost everyone will qualify for the traditional method. Again, this is Dr. Nguyen from Ironwood Cancer and Research Center in Mesa. I'm seeing patients in the Arbor office. Please come by and have a chat with me should you have any questions or concern. Thank you very much. So this concludes our talk on the accelerated partial breast irradiation technique. If you have any questions, please come in to see me at the Ironwood Cancer Research Center in Mesa off of Arbor. We're happy to accept any new patient at this time, and I'll address any question or concern that you have on our future visits. For other videos, please go to the Ironwood website, and it will most likely be there in one more link. Once again, thank you for your attention. This is Dr. Nguyen signing off.